Hi, I'm Paige Bennett.
I'm Nick VanSant, and we're presenting for Dependent Mothers.
We've gathered information on how woman-centered care can better treat pregnant women who are addicted to drugs during their pregnancy. We find it important we educate OB nurses on the proper screening for substance abuse, how women-centered care can lessen relapse rates, and educate on local resources. Research has shown the incidence rates for opioid and alcohol use has greatly increased within the past 20 years. Being educated on the symptoms of withdrawal from substance abuse is crucial. Nurses' role as a direct patient provider is to assess, educate, and refer based on specific patient needs. In a research study, 2 groups of pregnant women were divided into subgroups. One group received women-centered services during the pre- and postnatal period, and others did not. Group 1 was provided with trauma-informed care, child care, prenatal and postnatal care, pregnancy-specific housing and transportation assistance, breastfeeding education and support, family planning and counseling, STI screening, and parenting skills training. The researcher looked at different ways to measure the successfulness of women-centered care through the number of postpartum visits, who's now using a long-acting contraceptive, and those who actively breastfeed after discharge. As a result of this research, it was concluded that women-centered care that was provided to these pregnant women better affected the outcome of the child care following the pregnancy. This study looked at the difference between pregnancy-only support groups and mixed-gender support groups. When comparing the group relapse rate, the mixed-gender groups had a 25% higher chance of relapse. The group therapists experienced a high level of cohesion and trust among the participants within the pregnancy-only group. The pregnancy group members help one another problem-solve transportation and childcare issues, which are often gender-specific barriers to treatment for women. Lastly, 3 potential group members refused to participate in this study because they wanted to be in the pregnancy-only group. This shows that there is a population who would seek help if they could. Nurses are a key group in informing women about alcohol consumption during pregnancy and its consequences. Pregnant women drinking behavior is an attribute to the information they receive from nurses. A study we found explored women's perception of information they receive from nurses about alcohol use during pregnancy. Women reported a number of inconsistent information about alcohol use, mixed messages, and confusion about identifying a safe level of consumption had implications for women to drink during pregnancy and expressed the need for a clear and consistent message to be provided for women as early as possible. Screening can distinguish patients with low-risk substance abuse from those with risky use, harmful use, or dependence. The main purpose of those screening tools is to identify patients with substance or alcohol abuse who can benefit from early intervention and treatment. Universal implementation of alcohol screening and counseling to pregnant women and persons of a reproductive age could help with the achievement of decreasing the number of women that use opioids and alcohol during pregnancy.
We found a research article that discussed the importance of group therapy. 2 major themes emerged from the group transcripts. First, women found the educational content useful, and secondly, women appreciate the social support provided by the groups. These women spoke in length about the guilt they felt pre- and postpartum and how support groups can offer more benefits than just crushing their addiction. Pairing support groups with education is key. There are many barriers when it comes to treatment for dependent mothers, some of which include transportation issues, childcare, a lack of education, the fear of stigma when it comes to seeking help, especially when it comes to help with drugs. Many mothers fear punishment and or looking like a bad mother. Other issues include cost of treatment and insurance, or logistical issues when setting up appointments and pairing them with group sessions and the environment. Some women have expressed their desire for women-only support groups and have turned down care for mixed-gender support groups. Here's a local resource we discovered that nurses can refer their patients to called First Step Home, located in Walnut Hills, Cincinnati, Ohio. Additionally, we found a local addiction council outpatient service that serves Northern Kentucky and the greater Cincinnati area. On a national level, we found both the American Pregnancy Hotline and the National Council on Alcoholism and Drug Dependence, which can be referred to for patients all over the country. We decided to educate the nurses and the students on the labor and delivery unit at Fort Hamilton Hospital about proper screening tools for substance abuse, how women-centered care can lessen relapse rates, and options for available resources. We administered a pretest to gather the audience's baseline knowledge prior to education. The questions on the pretest focus on participants' level of comfort discussing substance abuse, confidence in their hospital screening tools, and if they are aware of any resources to offer to the patients. After presenting an educational pamphlet and a live PowerPoint to the audience, the post-test was administered. The post-test consisted of the same 4 questions on the pretest and an additional 3 questions to gauge how successful our education was received. Looking at questions on both pre- and post-test, you can see that the audience felt way more comfortable about asking about substance abuse. Looking at question 3 on the pre-test and question 2 on the post-test, you can see the audience we presented to felt as if they had way more resources to provide to their patients. Here are resources. We hope the education presented will make an impact and lead to better outcomes for struggling mothers in the Cincinnati area and even beyond. Thank you again for listening.